Thank you, Sue, for the introduction. So really just want to start by saying thank you to everybody coming to listen tonight. There's no doubt that it's a very important and contemporaneous topic that we all care about. So I'm going to start what is a group presentation tonight. And I just want to highlight that although we all work separately, our work unites with a shared focus on supporting pregnant mothers, children and families experiencing homelessness. So as Sue said, myself and Monica will be highlighting our research in this area, whilst Belinda and Angie will give an overview of working in the third sector. But really what unites our work is the core belief that being pregnant or living with children in homeless temporary accommodation has specific challenges and detrimental health impacts for pregnant women and children that need more understanding, needs more research, more support and more response from both health services and the government. So I'll be talking about health impacts and barriers to accessing care whilst pregnant and homeless, based on qualitative research I led with University of Dundee's Mother, Infant and Child Research Group. And I want to acknowledge the research was funded by Wellbeing of Women, Royal College of Midwives and Burdett Trust for Nursing, and to thank Wellbeing of Women for their support with this project. However, first, I think it's really important to contextualise this research and highlight why we need to have a gendered lens on homelessness so that we can acknowledge the structural inequality shaping women's homelessness. So women are considered more at risk of homelessness because of economic inequalities. They're more likely to have caring responsibilities, and as a result of those caring responsibilities, they may face increased financial disadvantage because of part-time or precarious work. So they're less likely to be homeowners in the UK. Pregnant women are further at risk of homelessness because of the known rise in domestic violence and relationship breakdown that occurs during pregnancy. However, homeless data is often based on formal homeless applications to local authorities. And what we know from previous research is that women with children are less likely to make formal homeless applications because of fear of child removal if they present themselves to services. Instead, what we know is that women are more likely to resort to informal solutions to their homelessness, so surfing with friends or with family. And that means they won't show up in government data around homelessness because they haven't made a formal homeless application. And when we think about women who might not have recourse to public funds, as Belinda will highlight later, they are even more invisible from the data. So this really perpetuates this absence of women and pregnant mothers from the homeless data and continues an underrepresentation of their needs in homeless services, research and policy. So we know actually very little about the numbers of pregnant women facing homelessness in the UK because they're not recorded. Pregnant women are included in family homeless statistics. And I know my co-presenters tonight are going to present some of those statistics. So I would just share from a Scottish perspective that in 2024, 30% of the households in temporary accommodation were families. So that's pregnant women and children. And that's a 5% increase from 2023 alone. So homelessness is an increasing clinical concern for maternity healthcare professionals. What we know from previous research is that homelessness in pregnancy is associated with an increased risk of stillbirth, preterm birth, and poorer outcomes for both mother and baby. However, there has been a tendency to focus primarily on street sleeping as the only form of homelessness in research, and to emphasise fetal outcomes only. So my research design was really grounded in a critical feminist and an interpretivist paradigm, and used qualitative methods to really make sure that the voices and the lived experience of pregnant mothers were at the centre. How did they feel about homelessness impacting their pregnancy? So between December 2022 and March 2023, I conducted 14 semi-structured interviews with mothers across the UK who had experienced homelessness in pregnancy within the last 2 years, and with 6 key workers from charities that support homeless women. This current research is actually under review for publication, so I can't go into depth about the actual analysis procedures or the findings from the thematic analysis. But what I will be presenting to you tonight is one of the key research outputs, which was an infographic for midwives and maternity healthcare professionals that was co-produced with the mothers in the research and the lived experience group of mothers. And that infographic is currently open access and available via a QR code at the end. So if we look at health impacts in pregnancy first, thinking about physical health impacts. So poor housing standards in temporary accommodation are common, meaning that pregnant women can be exposed to environmental hazards such as damp, mould and vermin. They may also be regularly exposed to passive smoking risks, and that includes drug smokes in communal areas. All the mothers in this piece of research reported feeling worried and anxious about what impact these environmental hazards had on their unborn baby. Physical health in pregnancy can also be impacted by reduced nutritional intake because there is a lack of access to cooking facilities in temporary accommodation. Some of the women had shared kitchens, but they couldn't take their children into the shared kitchens. It wasn't allowed, or there were strict rotas about who could access it when. And some of the women had access only to kettles in bedrooms, and some women who were in hotels had only access to meals at set times and no access to food outside of these times. And all this is compounded by limited financial resources with which to buy additional food. And then thinking about well-being impacts, these mothers reported stress and anxiety from constant housing insecurity, feeling unsafe where they were staying in shared accommodation, and sometimes this was mixed gendered shared accommodation as well. So they self-isolated in these overcrowded conditions and cramped rooms, and all the mothers in this research linked their living conditions directly to poor perinatal mental health in pregnancy. Thinking about barriers to accessing maternity care, frequently moving is very common whilst homeless. 3 of the women in this research were moved 6 times during that one pregnancy, and 2 of those women were moved at 36 and 38 weeks pregnant. So this is obviously physically and mentally stressful, but the mothers in the research also revealed a sense of feeling that local authorities didn't appreciate their increased need for a secure home before birth. Both of those women who were moved just weeks before giving birth were not giving any extra time other than the usual 24 hours notice to be out of one property and into another. And that they said that left them feeling very unseen and dehumanized by the system. Obviously, frequent moves also disrupts antenatal care. They may have to register with new healthcare services, and that can delay access to routine midwifery care, to scans, to screening tests, access to repeat prescriptions, and really importantly, it may create barriers in seeking midwifery care in the context of reduced fetal movements, especially if they've just been moved to a new area and they don't know how to contact triage yet. And it's really important to note that although proof of address is not a legal requirement for registering at a GP, it's still a commonly reported barrier to accessing care whilst homeless. In the context of referrals, the referrals may be sent to old addresses that pregnant women have moved on from. So it's really important to look at those causes of did not attend at the level of the system, not at the level of the individual. And then finally, a further barrier was lack of internet access in temporary accommodation, which can make accessing digital maternity notes like Badgernet very difficult. And that left women feeling unable to make informed choices about decisions around their care plans. This next part of the infographic really summarises what the pregnant mothers said about how challenging it can be to engage with midwifery services and maternity healthcare professionals, because there's so much fear of judgment and stigma and fear of child removal, as well as this constant stress and anxiety of not knowing where they would actually be housed once the baby was born. And we know that previous research has highlighted that high levels of stress in pregnancy can have a detrimental effect in utero and in the early years. So really, how can we as midwives and maternity healthcare professionals support pregnant women experiencing homelessness? This final part of the infographic really summarised what the pregnant mothers in the research identified were their key needs from their midwifery care and maternity services. For the purposes of time tonight, I'm just going to emphasise 2 key points here. Pregnant women may find it actually really helpful to be asked directly about their living conditions, because this overcomes barriers of stigma and fear of child removal, because the midwife is opening up the conversation. So think about asking, do you feel safe where you're currently living? Have you got somewhere safe and warm for baby to sleep? And the final point that I'd like to share from the women is this power of feeling seen and heard, because quite often they feel unseen in housing systems. They often felt that local authorities and the homeless system didn't really understand their specific needs in pregnancy or prioritise their need for a safe and secure home before the baby was born. So every interaction with a maternity healthcare professional then became an opportunity to counteract that sense of feeling unseen and unheard. And often it was the small acts that really impacted the mothers. So, for example, the triage midwife who'd arranged a side room in early labour because she understood that home was not a safe space for that woman to go back to that would help labour establish. Or the maternity care assistant who changed her rota around, so she made sure that she did all the postnatal feeding support visits because she could see how distressing it was for the mother to have to keep repeating her story of why she was sleeping on a sofa. Or the community midwife who wrote multiple times to the council to express concerns about where the mother was living. All these acts may or may not change their situation, but the real impact that the mothers shared was that they said it made them feel supported, it made them feel seen, and it made them feel heard in their midwifery care. And the impact of that should never be underestimated. So I will end there with a link to the infographic and some references and some further reading, and I will hand over to my co-presenters tonight and look forward to some questions coming up soon. Thank you for your time.